Hi, everybody. This is Don Ferguson with Viper Consulting TV. We've had a lot of our viewers ask, how do you find a great physical therapist? Today we have with us Kimberlee Sullivan with Sullivan Physical Therapy in Austin, Texas. Hi, Kimberlee. How you doing?
I'm doing well, Don. How are you?
I am doing great. Kimberlee's got 12 years of being a physical therapist and running a physical therapy business. Kimberlee, can you tell our audience, when somebody needs a physical therapist or they're looking to get involved with a physical therapist, how do you find a great physical therapist?
I'd love to answer that question, Don. The first thing I would do is I'd ask word of mouth. I'd go and ask my friends, my family, other physical therapists, physicians, healthcare workers, who they recommend as a physical therapist in your town. I would also do and look at a reputation. What is the reputation online? Go on to online reviews. See what the public is saying about the clinic, both the front with the front administration, the secretary, and then also the physical therapist. What are they saying? By checking the online reviews, this will provide you insight into the office. I'd also look at an expert. Is the physical therapist that you've been recommended an expert? Dawn, did you know that there's actually 8 specialties in physical therapy?
No, I didn't. I thought a physical therapist was pretty much as a physical therapist. I mean, they actually specialize?
Yes, there's 8 specialties, including geriatrics, pediatrics, neurology, also women's health, orthopedics. There's a lot of different specialties, but there's a total of 8. And what we do is we have board specialized physical therapists. So I would call the office and I'd ask if one of the physical therapists in the clinic is actually board certified in this specialty. In addition, I would call the office and ask how long the business has been there, how long the physical therapist has been in practice, and ask any other questions that you might have, whether it's regarding scheduling or insurance. By asking these questions, you'll get a clearer picture of the clinic and its expertise. And last, I would look at the quality of service. When you're actually at the clinic, I would want you to ask yourself, do you feel like your best interests are what the physical therapist and the front office staff is looking for? Are you being treated with respect by the whole staff? Do they seek your feedback? And do you feel that their knowledge is good about your diagnosis and prognosis? And can the front office answer questions about insurance? But most importantly, when you're there in the office, do you feel comfortable in that setting? And with those 4 things, word of mouth, reputation, is the clinic an expert, and quality of service, if you can answer any of those questions, you should find a very good physical therapist.
Great advice, Kimberlee. We appreciate that. Let me ask you one more thing now. Texas is one of those states where you have to have a physician's referral to come see a physical therapist versus a lot of other states. Can you elaborate on that a little bit?
So the state of Texas requires anyone who's going to be evaluated and treated by a physical therapist to have a prescription from a referring physician.
Okay, very good. Well, Kimberlee, again, you've been in business for 12 years.
I have.
That's a long time, and I'm sure you served a bunch of very happy customers. What makes your practice different from other practices?
Well, I'm glad you asked that, Don. We are a women's and men's health physical therapy clinic, which means we treat diagnosis of urinary incontinence, constipation, pelvic pain, pre- and postnatal conditions. So that separates us. But let me explain to you a little bit about a couple cases to get you a clearer understanding of the type of patient that we treat. Recently, I just diagnosed a woman who had abdominal and pelvic pain 6 months after delivering her son. She had a cesarean scar that was causing her to have pain every single time she stood up, carried her son, lifted him, and put him into his crib. So she came to the clinic and I treated her with manual techniques, which were trigger point releases to her abdominal wall and then also scar tissue release. This allowed her to be pain-free after 6 visits. In addition, I gave her abdominal exercises to strengthen her abdomen so that when she did lift, that she didn't re-injure herself. Another case that I would recommend, or what I would talk about, is a patient who has incontinence post-prostatectomy. Because of the surgery, it can cause incontinence in men. Incontinence would be leaking with coughing, sneezing, laughing, lifting. And what the therapist at my clinic would do is give them exercises to strengthen their pelvic floor to stop leaking. So this would be exercises to recruit the pelvic floor muscle when they get out of a chair or bending over or coughing and sneezing. But besides the specialty, I would say that my staff is what separates us from other clinics. Our physical therapists see each patient one-on-one. Each one of our physical therapists have a doctorate in physical therapy and receive over 20 continuing education hours a year in our specialty alone. In addition, my front office staff is always complimented on the fact that they greet people by name and with a smile, and that they're able to answer questions. We have a medical coding and billing specialist on site to be able to answer any insurance questions that a patient might have. We also offer a webinar series, radio, and online blog to educate not only our patients, but the community at large, because everybody wants to know what women's and men's health physical therapy is all about.
That's awesome. Now, for those educational kind of things, they just go to your website, right? Can you tell me what your website is?
Yes, it's www.sullivanphysicaltherapy.com.
Well, Kimberlee, I know you do something special for new clients. What is it you do for them?
Well, Dawn, everybody asks me, what is women's and men's health physical therapy, and what am I getting myself into? So because of that, we can offer a free consultation on the phone with one of the doctors of physical therapy in our clinic to answer any questions that you might have about the evaluation and treatment of physical therapy.
That is great. I tell you what, I've learned so much more about what a physical therapist does than what I thought I knew. I thought it was like you got hurt in a sporting accident or a car accident or something like that. I didn't know there were so many different kinds of fields, so thank you for giving us that type of information.
You're welcome, Don.
Well, everybody, this is Don with Viper Consulting TV. We've learned about how to find a great physical therapist today. Please sign on for other in the series that we have, and have a great day. Thank you, Kimberlee.
Thank you, Don.
So what you think?